When a patient books with Xroid for a treatment, what can they expect?
Okay, so if a patient's got an appointment and they turn up at the clinic, they'll be met there, they'll be signed in, and a chaperone will usually then, at the relevant time, bring them in to meet the doctor. So that might be me, for example. So I'll greet the patient, we'll introduce each other, we'll start to take a medical history, so talking about the problems that they've had, the symptoms, how it's impacted their life, what treatments they might have had in the past. And then eventually we'll get round to discussing what Xroid is, what it can do, what the potential complications might be, and all of that. And beyond that, the next step is we need to have a look because we need to confirm a diagnosis. At that point, they may or may not have piles. Most patients do, but not everybody. So we need to confirm that. We need to do a consent process. And then if it's appropriate, the patient can have the treatment at the same visit. So for those patients where they respond to a single treatment, coming in, shaking my hand, saying hello, to shaking my hand and saying goodbye at the end, can take an hour. And that may be the only visit they need to get complete relief from their symptoms.
Excellent, okay. So what can the patient expect afterwards?
So afterwards, most people get up and go home. We know from the patients that we have treated and the feedback we've had, about 1% of them will have some pain afterwards, but simple paracetamol is usually all they need to settle it down, and in most patients within 24 hours, they're absolutely fine.
So they can just go back to doing what they were doing before?
Absolutely, and that's one of the advantages of Xroid, is that patients can walk in, have it done, and walk out and get on with their life. A lot of people will go shopping, they'll go back to work, they'll do whatever they want to do. There's only a tiny proportion that might just take a little bit longer to get over their treatment visit.
Okay, thanks. So what would, will Xroid treatment cure piles?
I think potentially. A cure for piles would suggest that they will never ever come back again, and I'd say there is no treatment that exists that can do that, because after any treatment, whether it's surgical or Xroid or heat treatment, symptoms can recur, and part of that is down to the patient's genetics, the fact that they're going to be getting older, and we know that hemorrhoids are more common as we get older, and other factors, lifestyle factors. Do they get constipated? Do they have illness that impacts on them? Do they take medication that could make them constipated? So there are all sorts of factors that could impact on them getting hemorrhoids again or hemorrhoid symptoms again. But Xroid can work just as well as anything else in terms of controlling the symptoms. And then a lot of it's down to the patient and what they do afterwards and what happens to them as to whether they may get symptoms again.
Okay, so if a patient has symptomatic hemorrhoids further down the line, say a couple of years after they've had an Xroid treatment, are they able to come back and have a further treatment? Absolutely,
yeah, and patients can come back. If they've got complex piles, they may need more than one treatment at the outset, but once they've got symptomatic relief, if a year or 10 years later they have further symptoms, they can come back and have further treatment. And that's fairly unusual compared to a lot of the other, certainly surgical treatments, when you can't keep coming back and having a hemorrhoidectomy, because the risks get so high in terms of the potential complications that could arise. But in theory, you can come back and have Xroid again and again, because it's such a non-scarring treatment that it can be used again and again.
And if a patient's already had a hemorrhoidectomy, for example, or band-in, are they able to take advantage of Xroid?
Yes, again. And patients that have had a hemorrhoidectomy tend not to want to go down that particular pathway again because it is so painful afterwards, but it is a very effective treatment. But if they've had a hemorrhoidectomy, they can come in, they can have an Xroid treatment, and those that have had a hemorrhoidectomy before and then have Xroid, there is no comparison. They can get over it so much more quickly. Yeah. Typically a minimum of 2 weeks after a hemorrhoidectomy, but after having had Xroid, literally it's walk in and walk out.
Lovely, thank you.